Since Bernie Sanders introduced his Medicare for All bill, he's had to put up with a lot of really disingenuous and downright arbitrary attacks from pundits in the media. And no, I'm not just talking about Fox News, because of course they attacked single payer as well, specifically this particular bill. But in the so-called liberal media, there were some pundits that went after this bill with a vengeance. Now, one individual in particular who did this is Chuck Todd. Now, Chuck Todd is typically a more soft-spoken, polite pundit that is known to give more softball interviews to politicians and never really challenges them. However, when it comes to the issue of single payer, well, things are a little bit different here for Chuck, because throughout a series of clips here, it became really clear that Chuck Todd wasn't just holding this bill up to a reasonable level of scrutiny, which would be understandable, but he had the goal to downright destroy it. And I think that that will become clear after I show you a bunch of clips and interviews that he did with politicians who were promoting this particular bill. Now, he has a ton of arguments against this particular bill, but first of all, he states that it might be a bad idea because it is something that's divisive and it might actually hurt Democrats who are up for re-election in 2018 and 2020.
And right now, Sanders is driving a big wedge between the progressive left and the moderate left with his Medicare for All health care bill. His backers include a lot of folks who are keeping their eyes on 2020. But get this, not a single Senate Democrat that's facing a tough re-election in 2018, including Sherrod Brown, who normally would be on board something like Medicare for All, they haven't signed on. The Senate top Democrat Chuck Schumer won't endorse it either when asked about it today. In the age of Trump, a lot of folks from both sides are in survival mode with seemingly few good options. On the left, if you even say the president isn't going to be impeached, as Senator Dianne Feinstein recently did, you get skewered by the base.
So what Chuck Todd is doing here is he's promoting the idea that if you are a Democrat who's running in a relatively conservative state or a purple state, that you can't get on board with Medicare for All because conservative voters just won't go for that. But this is an outdated way of thinking because public opinion polls show that a majority of Americans, including a plurality of Republicans now, support a Medicare for All system. In fact, there's even been a number of focus groups with Trump supporters, and they've indicated that they also support the idea of single payer. So in asserting that the Democratic Party, if you're up for re-election, you just can't push single payer, that's wrong. Yes, they can. If they push for single payer, that will make them even more likely to win because that will encourage their base, who's been disenfranchised over the course of the last decade, to come back out and support them once again. But Chuck Todd knows this. Chuck Todd has stated himself that he knows that public opinion on this particular issue has shifted in favor of single payer. But what he's contending is that, well, when people truly find out about how much their taxes will increase as a result of single payer, then they're just not going to go for it. But in this next clip here, Bernie Sanders explained exactly why he's wrong.
Obviously, Senator, the issue of this is there's the idea of health care for all is something that has majority support. And then when you remind people how much it could cost, how much taxes go up, then people get concerned. And obviously, you were concerned about the finances there. Explain what you mean and how you can change the funding system to not make this so astronomical.
Okay, very good question, Chuck. But here is my hope. You and I are going to discuss this within 5 minutes. I would hope very much that NBC and CBS and ABC allow us some serious discussion time to explain to people in our country why we are spending so much more than other countries. But very briefly, and I would hope that we can have an hour discussion at some point on this issue. Very briefly, this is what we're going to do. Number one, private insurance companies in this country spend between 12 and 18% on administration costs, and they're administering hundreds of different private insurance plans. You have a deductible of $5,000, I have one of $8,000. It is incredibly complicated and very costly to administer. The cost of administering the Medicare program, a very popular program that works well for our seniors, is 2%. We can save approximately $500 billion a year just in administration costs. Okay. Second of all, because we pay so much more per capita on health for our prescription drugs, by having Medicare negotiate drug prices, we can save over $100 billion there. So that's a lot of savings. Thirdly, and here is the important point, my Republican friends say, well, Bernie wants to raise your taxes. They forget to conveniently mention that Bernie wants to do away with the private insurance premiums that you're now paying. For example, Chuck, the average employer who has a worker who makes $50,000 a year is spending $13,000 a year on health insurance for that worker. The worker himself or herself is spending $5,000, $18,000. Now, if our plan goes into effect, that $13,000 private insurance premium disappears for the employer. It goes down. The amount of money that the worker is now spending, that $5,000, goes down. We replace private insurance premiums with Medicare premiums. The average middle-class worker saves money.
Now, that last part of what Bernie Sanders said is really important, because even though taxes will go up, well, you're still going to have more money in your pocket if you're an ordinary American, because you will no longer have to pay your monthly insurance premium. You won't have to pay for deductibles. And this is a really important point that, as Bernie Sanders put it, a lot of not just Republicans, but mainstream media pundits conveniently leave out. But Chuck Todd also raises another objection to single payer, and I think that this is more reasonable still. We haven't gone into full-on attack mode yet, but he asks, you know, how are you going to convince people who currently like their healthcare policy to switch to single payer? And this is what Bernie Sanders had to say.
Well, I guess the question I have for you, though, is how do you convince some 80% of Americans who do get health care from their employer that it is worth rejiggering the system again? That seems to be the other challenge here, because as you know, people that get employer-based private insurance are basically happy with their insurance. The people that are not happy are those in that other 20%.
Well, yes and no. And in fact, we are going to need a lot of discussion. And again, I would hope that on NBC, CBS, ABC, we can begin to have that kind of discussion in a serious way. But here is the truth. You know, Gallup does a lot of polling on this issue. And what they find out is that the most popular health insurance program in this country is Medicare. Right. People, seniors, feel really good. Veterans Administration ranks very high. In fact, private insurance company is not all that popular. Well, we have to tell the average worker the only thing that is changing in this program, this is not, quote unquote, a government takeover. The only thing that's changing is the color of your insurance card, from a Blue Cross Blue Shield card, a United Health card, to a Medicare for All card. You're still going to go to the doctor you want. It's the same structure.
So up until this point, with these clips that I've shown you, I think that in raising objections to single payer, I'm fine with that. I understand that in introducing this bill, there would be criticism, and you do have to hold it up to scrutiny to prove that it will work, because I believe in it. So I'm not against any and all criticism to single payer. I think that it's important that we make the case for it now and address all of these criticisms, but what Chuck Todd does in these next couple of clips, it really demonstrates that he has an agenda. It's not just about holding single payer, you know, up to a certain level of scrutiny. I mean, he just outright goes in for the kill, and he goes after single payer with a vengeance. And if these last couple of clips didn't make his agenda clear, then these ones certainly will.
Why muddy up this issue? Why spend so much time working on a new health care plan when the Democratic Party took so many bullets for fighting for Obamacare, and you've still been fighting for it, and it's still the law of the land?
Well, in the course of arguing over Trump care, Trump wealth care, I might add, we talked to our citizens across the country. I had 36 town halls in Oregon, mostly in Republican counties, 2/3 of them. And what those citizens in Republican counties came out and said is our health care system is just too complicated, too inefficient, and too stressful. And there was real desire, and I'm talking Republican counties, for a simple, seamless health care that just by virtue of being an American, you have coverage when you need it.
Look, it sounds great. Everybody wants this until you tell them they're going to have their taxes raised in order to pay for it. That's number one. But again, I go back to Obamacare. Is this your way of saying Obamacare is a failure?
No, this is our way of saying that in the course of defending Obamacare, because it was such a leap forward, we're also very aware of how stressful health care remains. It's just a gauntlet of paperwork and complexity that no other developed citizens and no other developed nation face, and shouldn't have to face here.
So,
and it's cheaper. It's cheaper for our nation. Think about the fact that Medicare,
let me ask you this. You say it's cheaper for the nation, but whether you use the Sanders estimate of $14 trillion over 10 years, an additional $1.4 trillion in the federal spending, and that's one estimate. Another puts it twice that a year, $3 trillion a year. Where do you get this money?
Because the same estimates say that the total spending by our citizenry on federal budget and off federal budget put together, because that's the total cost to our society, goes down. And you can imagine why. Medicare has an overhead of about 3%. Private insurance has 25 to 30% that's wasted. Private insurance denies your claims even when they should cover what you have. So every time you are sick or you do have an accident or a member of your family, you have to go to war just in order to get the bill paid. That's an additional piece of the stress.
So as you can see here, Chuck Todd is being a lot more forceful, and this is really not characteristic of his usual temperament on his show. And he's really being aggressive in trying to combat single payer. And he pushed the same idea that citizens only support this until they learn that their taxes will go up. And he also asked the question about where you're going to find the money to pay for this bill. But that point is moot, because we're currently spending $49 trillion to prop up our current shitty system, whereas Medicare for All would literally save us trillions of dollars and cover more people. So it's cheaper because if every single medical bill in this country is paid for, then that keeps the costs down. But in our current system, the costs continue to skyrocket because there's no cost control mechanism. And when people get sick and they don't have insurance and they get medical attention, well, if they can't afford to pay for those medical bills, then that cost gets passed on to people with monthly insurance premiums. That's why the cost is going up. Now, let's say, hypothetically speaking, that Medicare for All actually did cost more than our current system. Well, that still doesn't mean that we shouldn't support it and that we don't have a moral obligation to take care of our citizens, because the Senate just overwhelmingly approved a $700 billion military spending bill. So I'm sure that after hearing about this news, Chuck Todd is going to come out strongly and challenge another senator who approved this spending bill and ask them how they're going to pay for that too, right? Well, of course not, because when it comes to corporate media, if you're spending money to prop up the military-industrial complex and kill people, you don't have to explain to us how you're going to pay for this. But when it comes to taking care of our own citizens, if there's even a possibility that that's going to cost more, then you better damn well figure out a way to fund it. It's just our priorities are completely ass backwards here, and it makes me so angry every time I hear a politician ask this question. It's not that, they shouldn't be concerned with how to pay for single payer, because I think we all should, but it's the hypocrisy in giving defense bills a pass, but making sure that we better damn well come up with some way to pay for this. I mean, why don't you ask the same question and pay the same level of scrutiny to bills that are harmful? Why doesn't anyone in the mainstream media do that? It's because this is what you get with corporate media. But I mean, Jeff Merkley in this interview, he was answering all of Chuck Todd's questions. I think his responses were perfectly reasonable, but when Chuck Todd started to kind of run out of ways to challenge him, he just said, well, you know what, I don't believe you. I think it sounds too rosy.
I understand with the way you're painting it, but I'll be honest, Senator Merkley, it sounds a little too rosy. I hear you on all that, but it sounds like you're promising the world. And it feels like I'm having a deja vu when Republicans essentially spent 8 years over-promising and under-delivering, and their voters have now punished them for it. Their voters turned to a guy that had no experience ever running for political office to be their nominee because they were tired of broken promises to the base. How does this not end up as a broken promise, pie in the sky, over-promise, under-deliver?
Well, I can certainly contest your theory there, because they turned to someone who promised the world and had no plan to back it up. Your health care will cost less. Your health care will be of higher quality. And then
how are you guaranteeing? This is not about Donald Trump, though. My point was the Republican Party went down this road, over-promising, not delivering. This feels like something, there is no pathway to pass it. Are you not raising expectations only to essentially bring back the cynicism that politicians just love to tell you everything is easy, we're going to make the system simple, and then you can't get it done?
it would be over-promising to say this bill is going to pass this year, that it's going to get a hearing. But to lay it out as a vision, as this honestly has been laid out, to say that we need to have discussions across America about how to make our health care better, and that's the way Bernie presented it today. This is important to our country, to wrestle with how we have a simply better system than we have at the moment. So those who say never talk about a vision of where we could go to because you can't get there tomorrow, I would say we'd never have any progress.
So understand just how foolish Chuck Todd looks here. He invokes Donald Trump, but then when Jeff Merkley responds and talks about why this is different than Donald Trump, then Chuck Todd says, no, don't change the conversation. I don't want to talk about Donald Trump. I want to talk about this bill. And furthermore, he talks about cynicism. Well, the reason why Americans are cynical is because the Democratic Party, or neither party, has been fighting for them. But with this bill, this will reduce cynicism because for the first time in what seems like forever, politicians are fighting for us. We want single payer. You know this, Todd. You said it. A majority of the public wants single payer. So Chuck Todd knows all of this, but he has an agenda. His agenda is to defeat single payer, which is why he's a lot more aggressive in these clips and combative even than we've seen him in a really long time, because it looks like he got a stern talking to by an executive at MSNBC that told him to stop being so timid, at least when it comes to this bill, because if Medicare for All causes health insurers to go bankrupt, then that's millions in potential advertising dollars that MSNBC loses. Now, of course, I'm only speculating, but the point is that the media has an agenda. Chuck Todd wasn't interested in informing people about Medicare for All and raising these objections so that way they would know how to, come up with counter arguments. What Chuck Todd wanted to do was defeat single payer. And throughout the course of this last week, we've heard him make a ton of different arguments against single payer. First of all, he said that citizens will only support it until they realize how much the taxes go up. He literally said it's pie in the sky. It'll never get passed. The timing is off, and Democrats should be only defending the ACA. It sounds too rosy. It's too expensive. Well, here's the reason why you're wrong, Todd. It's because Medicare for All is not a new idea. Why don't you bring on some Canadians and ask them what they think about their Medicare for All system? They love it. They absolutely love their single-payer system, and they approve of it, and they take pride in their system. This is what public opinion polls in Canada shows. So you're wrong. All these objections that you're raising about how it's too rosy and it'll never happen, the same people within the health insurance industry made the same argument, I'm sure, back when they were pushing for this in Canada. So you don't care about that, though, do you, Todd? You only care about defeating single payer because you work for a large corporation that has an agenda, a corporate agenda specifically, and your goal isn't to inform viewers. Your goal is to defeat single payer, but we're on to you, Chuck Todd, and what you're doing here is completely arbitrary, it's unfair, and it's downright immoral, because in choosing to defeat single payer at the behest of your corporate overlords, you are helping to maintain the status quo, which isn't working out for Americans. People are dying, Chuck, because they don't have health insurance. People are going bankrupt because they don't have health insurance. And as an elite who's rich, who's a multimillionaire, you'll never know what that struggle is like. So what you're doing here is damaging. It's so harmful, and it's immoral. And you should be ashamed of yourself.
Support this podcast by becoming a patron at patreon.com/Humanist Report.